Go ahead. Go ahead. Harder. Go ahead. Great job. I'm Dr. Dhir, a facial plastic surgeon in Beverly Hills. I want to show you my patients are real people who want natural results. Right now, I'm prepping for a surgery that's tomorrow. Savannah is a really sweet patient, 17 years old. Within the last year to 2 years, she had a nasal fracture. She underwent a procedure to fix that break. Unfortunately, after the procedure, she was never happy with her nose, and she felt that it was not in line with her self-image. When we do a rhinoplasty or a nose job procedure, I want to make sure that we not only get a really good-looking nose, but we also have a really good functioning nose, and I want her to breathe well. So number one, we're going to address her breathing, and then number two, her nose is a little strong for her face, so we want to soften her nose. She's got a small dorsal hump or a hump on the side of her nose. We're going to make it straighter. Her bones that she broke, we want to make sure that those are straight as well, so that her front view is straight. And number three, we're going to address her nasal tip. I'm going to use small rubber splints that are very soft to hold the nose straight. Those are painless to remove, and in general, like to not use packing when I don't have to. So we're starting our surgical in the morning. It's about 7 a.m. when I arrive. I get to meet with the nursing staff, set up the plan, and then also I have a chance to sit with the patient, reconnect to make sure that we're on the same plan, make sure that I answer any last minute questions and get any last minute jitters out of the way.
I don't feel like my nose fits me, and Dr. Dhir was telling me as well, like he feels as if it doesn't fit me and my personality, so I've just really been wanting to change it. I trust Dr. Dhir. I feel like he's gonna give me exactly what I want, along with help me with my breathing. So I feel like change is good, change is okay.
So we have a couple goals here. Number one is, this is the nasal hump. We're gonna take that down so it's straight to a little bit scooped. You don't want it perfectly straight, right? I also want to put these bones back to the center. This is going to be where we focus a lot of our energy on today, is that we want to refine or define this nasal tip. Right now it's more bulbous or circular, and also support it by bringing it forward, okay? So that's what we're going to do. Let's get you into surgery. You ready? It's a very vulnerable position. She's been wanting this for a long time. I think she's physically ready for it, as well as I think emotionally this is going to be good for her. I find out what her favorite music is, and we'll set up her music while she comes in, and we'll get to work. Your legs go straight over this. And we have a warm blanket for you. Feels good, right?
I get really cold so easily.
Yeah, that's why we got this warming thing on you. You feel it?
Yeah.
So that's kind of cool, right?
Stockings on your lower legs right now.
Okay.
Those are massage squeezers. Keep your head straight. I have a personal connection with nose jobs because I got a nose job when I was 18 years old. I understand the emotional aspect between changing someone's nose, and it helped me with my internal confidence, and I want to offer that same experience for my patients. This is where I get to do what I love doing. All right, we got your ratchet music playing. Everything's gonna be great. Think great thoughts, and I'll see you when you wake up, okay?
Thank you.
All right, so first we're gonna inject the nose. This helps us with the best way of getting the least amount of bleeding. No allergies, Decadron, and pre-op antibiotics?
Yes.
Good. One major part we talk about is breathing, which is very important for, obviously, for a nose. Even if it's just cosmetic, you wanna make sure that you're doing the best thing possible for breathing. And so let me just clean up here. So I'm using a scope to show you the inside of the nose. The septum here is mildly to moderately deviated, not the worst, but it's very swollen with allergies, so we're gonna try to shrink this to give her an open airway. On the other side of her nose, we have a different situation, is that from her trauma, her septum, which is here, has gone off the midline, and so it's deviating the other side, but it's also left us with the bone that's obstructing her left nostril, so we need to deal with this part here to straighten her nose, as well as give her an airway. And you can see right here, it's very tight to get to the back of the nose. All right, so we're getting close to bringing out the graft. I like to bring it up back in one piece. That's the goal. Her nose is really deflected from the trauma, so it's a little bit harder to get what I want here, but we're getting there. Okay, here we go. One nice piece. This is actually a nice piece, right? Mm-hmm. We're able to get some good grafting. It was totally crooked off the bottom like this. So here's our piece. This is really nice cartilage. It's structured, it's thick. If we have enough of it like we do, we can do most grafting from here other than going to the ear and the rib. So we're gonna start to carve our strut, which is for the tip. and also a shield graft. And so here we go. I'm going to be using this strut here on the tip to give her support, and these are her cartilages of her tip that I've kind of refined. I'll be putting this graft here, which is a shield graft, on front to give it more refinement. And I'll be using these for spreader grafts, which will go up here if I need it for making her breathe better and to keep the nose straight. I'll show you when we put them in. A major issue for most people who come in for rhinoplasty, they always want the hump. Taking the hump down is very difficult in the sense it's artistic, but it's not the only thing to do in a nose. If you do the hump, this skin is not elevated by the hump anymore, and the tip will fall even worse. You must do something to the tip to support it to make a nice contoured natural nose. But the first step is taking this hump down, and I'll show you the side profile when we're done. Go ahead. Go ahead. Many times when the bones of the nose are shifted over to one side, you have to ultimately break the nose to put it back in the midline. It doesn't have to be done every time, but that is the reason why we have to break a nose. So we make incision on the inside of the nose, and very interestingly, the tip of the nose has some interesting anatomy. These are the cartilages that make up the tip of our nose, and I bring them out, and I'm able to make them thinner, more refined on both sides, which we'll be doing with some sutures. I'm going to put some grafting to give it some support, and so when I put it all back in, we can shape the tip to our liking and to what she wants to have in her internal vision of her nose. All right, this is a side profile now, right after surgery. She's got a minimal amount of bruising. Her eyes, as you can see, are not significantly bruised. You have a nice, beautiful dorsum now without any hump, a tip that's defined and up in the air and projected forward. As you can see, you have some swelling here, which is normal, but we have a straight dorsum. Straight. Nostrils are never the same size. That's normal, as we looked at before. But as you can see, that it's got a good straight tip. Hello. It's our big day today. How was your week?
It was good.
Was it better or worse than you expected?
It was better. I expected a lot more pain.
Well, today's gonna be a good day for you, okay? We're gonna do 3 things. Number 1 is I need to take off all the tape, take off the cast. No cheating, all right? Because we have to clean you up and make sure you're ready.
Okay.
On the inside, it's gonna be 2 steps. Number 1 is I'm gonna take those splints out. The question is always, does it hurt? It does not hurt. It's just uncomfortable for a second, but just expect it to not hurt. Once I do that, I have to clean up a little bit of the kind of like some of the mucus that builds up with the suction. Okay, so you hear a loud noise and a loud noise of suctioning, but don't be afraid.
Okay.
Once I get that mostly out, I'll spray your nose and then I'll numb up your nose, and then you're gonna have no pain whatsoever. But I can't spray it without getting some of the mucus out. And then I'll do my final cleaning.
Okay.
All right, and then of course the last step, which will be showing you the nose. Okay. All right. When you look at your nose, I just want you to be prepared. Side view, you're gonna love it. You're gonna be so excited that the cast is off. But then that next feeling is that it's full or fat. And that's normal because it's swollen.
Okay.
That needs a couple more weeks to settle down, which I told you about 80% in 2-3 weeks. And then the final 20% is up to 1 year. But so just look at the basic, okay?
Okay.
You ready?
I'm ready.
I'm proud of you.
Thank you.
All right. All right. So the first step, I'm gonna take out these splints. These splints are not very large. People always ask questions, why do we put them in? The reason I put them in is that they're soft and like they're silicone. And what that means is that they hold your septum, the mid part of your nose, together. And it kind of keeps things from bleeding. So I kind of need them, and I'm trying to get them smaller than I need, but just relax. Good. Okay, that was 1. The nose is a big place. It looks larger than it is. Doing great. Doing that, we'll get a suction started. First step done. Okay, head back. I'm gonna suction you. Good job. That's a loud noise I told you about. Amazing. All right, so take a break. We're gonna spray you up. All right, now I'm gonna give you that spray I told you about. This is gonna numb up your nose. And keep your head back. There you go. All right, let's get started on the cast. So it's like taking off a Band-Aid slowly, unfortunately. Okay.
It looks
so good.
Stop it,
You'll be able to
Gladys.
see in a
Gladys, you're
moment.
taking away all the excitement. So why don't you do me a favor and close your mouth and take a breath through your nose. How's that feel?
So much better.
All right, so I think we got a lot of our goals done. Before we look, I just want you to be prepared that this part is beautiful. It's just a little fat. It's going to come down. This part here looks like it's swollen. That's going to come down. And I think we got what we wanted on the side.
I'm gonna cry. Isn't it beautiful?
It's so beautiful. Thank you so much. I feel so much better. I love it. It's like exactly what I wanted. Thank you so much.
You did a bit. Oh, you know.
Right after the surgery, I went to Jamba Juice, and then I went to the mall, and then I went home, and then I went to Jamba Juice again. The hardest part about it was sleeping, having to like sleep sitting up, and then not being able to breathe out of my nose, and then having to have like chapped lips every day. I was really excited to see it. It's been a little over a month, and I feel a lot more confident knowing that like I can now see what my nose actually looks like now that all the bruising has gone down. Just knowing when people look at it, they're like, that's a cute nose. I feel more comfortable taking side views now that like my nose is done, and it's like cute. It's a cute little scoop. I love Dr. Dhir. He makes me feel really comfortable. I love Gladys too.
All right, so that's her 1 month post-op. I'm really happy for her. Swelling has pretty much come down about 80-90%, and it's finally taking shape of the nose that we wanted. I think we hit the goals that we discussed. She's got a little bit of ways to go just from minor healing, but she's happy and keep continuing with those selfies. I'm happy, I'm glad she's healing well, and I look forward to seeing the final result in about 11 months. Thanks for watching this episode of Plastic. You can keep up with me on social media. You can find me on Facebook. I'm Dhir Plastic Surgery on Instagram, and Dr. Dhir MD on Twitter. We'll see you next time.